I can't imagine me being a plumber.
Good morning. Welcome to our weekly press conference on COVID-19 event here in Bell County. As I did last week, I have several individuals with me here today that I think will be able to provide you with valuable information about COVID-19 and specifically COVID-19 here in Bell County. The healthcare professionals that I have with me here today are Dr. Chadwell, who is the director for the Bell County Public Health District. I have the chief nursing officer, Ms. Travis from Seton Medical Center, Harker Heights. I have the chief executive officer, Mr. Roberts from Advent Healthcare Systems in Killeen, and Dr. Robert Greenberg, who is the director of emergency medical services, Baylor Scott and White Temple. I want to say again, I very much appreciate the presence of these individuals here for their time and their expertise that they're willing to share here today for us. I also want to thank them for the work that they're doing, not just at this press conference and sharing information for us, but the work they're doing for all of Bell County and the healthcare professionals that they represent when they stand here, the thousands of healthcare professionals across Bell County. So I very much appreciate their work and our healthcare professionals' work. We did receive some questions in advance of this press conference. And we'll try to get to those as the speakers come forward. Some of those questions were directed specifically to certain speakers. So I've asked the speakers to try to address those if they can. If they can't or don't have those questions, which they may not, I'll try to reiterate those while they're at the podium, give them an opportunity to address those. And then we'll wrap back up at the end, or I'll wrap up at the end and I'll go back over some of those questions and hopefully respond to those. If we don't ask a question that you submitted in advance, then feel free to ask it during the press conference, and we'll certainly try to address it. With that, I'd like to call on Dr. Chadwell, Director of the Bell County Public Health District, for her comments.
Thank you, Judge Blackburn, and good morning. I'm having to remind myself what time it is. I've got, looks like about 2.5 pages of questions, so I'm going to try and get through these. I am going to tell you preliminarily, we have 174 on the last time I looked at the log today, but that will probably change by our update on the website today, so again, that's preliminary. I'm not going to go through the state and national numbers at this time of day because they don't update those until about noon typically. But what I will go ahead and do is go through the questions that I've received, and I'm going to try not to bore you all with the statistics lesson, but I'll go ahead and go through this as best I can. So the first question is, what trends are you seeing among the county's demographic groups for COVID-19? We're seeing about what we'd expect to see. Now, here's something to understand about whether you're talking about race data, ethnicity data, gender data. Gender data tends to be a bit more stable, but race and ethnicity data has error margins that are about this big. So the smaller your sample size, the less reliable that data is. And I'm going to tell you, 174 is a pretty small sample. So you can only glean so much from that information. About 19% of our cases have been hospitalized. That's not terrible. We'd like to see that lower, but that's not terrible. As far as our gender breakdown, about 51% of our cases are women. Fits with our demographic, that makes sense. And I'm going to go into the next question, which addresses race and ethnicity data. There is an early assessment that we have a disparity. The data just doesn't tell me that, in part because there's not enough of it. So for our race and ethnicity data, what I would caution you to do, number one, is bear in mind that census data is 10 years old. So you're comparing data we have today based on our current population with 10-year-old census data, so bear that in mind. You've got a pretty wide error margin there. And another thing to factor in too is that race ethnicity data is not a mandatory report. As you guys noted on our website, about 13% of people didn't report their ethnicity and about 10% of people didn't report race. And again, for a sample size this small, that has a lot of impact on the data. So what I would say for now, until we have more information and more data to put into that, you want to look at how our subgroups rank. So number one in our population is non-Hispanic whites. They have the greatest number of infections at 54%. That makes sense. Second subgroup is non-Hispanic blacks. Again, they're second in our infection data at 32%. It makes sense. Does it match perfectly with census data? No, but it isn't going to. So if you have further questions about that, shoot them to Paul and I will try and get more deeply into that if you'd like me to, but I'm not going to do that here. So why is race and ethnicity data separated on the dashboard? Typically, those are compiled into one chart to make it easier to understand. I have a little bit of a peeve with that. So race and ethnicity are actually two separate variables. Combining them onto one chart is likely to get messy, which is why we didn't do that. And it might not be messy right this second, but as we add more data, it probably will get messy. So how is the health district reaching out to minority communities to inform them about social distancing? As you know, we're using social media, we're using our website, we're obviously doing press conferences regularly, we're coordinating with all of our healthcare providers, we're coordinating with our city and county officials, our commissioners have been really helpful in communicating with their constituents, and our city officials have been helpful in doing that as well. We are also working with our health educator. The EPI team is working with her to compile some educational materials that we're planning to push out. We've also been pushing out CDC educational materials. We handed those out early on. Our inspectors are sharing those with restaurants. I know that our septic inspectors have been sharing those, and our commissioners did share those as well, hospitals, schools, all of that. They've all been working with us to push that information out as they can. And let's see, what about outreach to folks who do not have access to internet and TV? I think I just covered that a little bit. The pandemic has been going on for nearly 2 months. How is it impacting other public health operations? Well, substantially, I would say. We've had to, as I think I mentioned this in an early press conference, but I'll reiterate, we shut our doors to public access to protect our employees from potential exposure. We're doing appointment-only service, so you can still get service from medical nursing, environmental health. They're doing appointment only, so call the office and they'll work with you to see about getting an appointment set up if that's deemed necessary, or talk with you to discuss whatever issue you might have. The WIC clinics have been very, very busy. Their service has not slowed down an iota. They're doing curbside, and it's actually very innovative, and it's pretty impressive, and they've been very busy with that. And of course, preparedness has not stopped moving for 2 months, so they're tired. Let's see. Do you expect a rapid rise in cases as testing becomes more available? I don't know that I would say I expect a rapid rise, but I do expect to see more cases. I mean, there's a definite correlation between more testing and more cases. It would make sense. Whether or not the rise is going to be rapid remains to be seen, but we're keeping an eye on it. Can you provide an update on contact tracing figures for how many people have been contacted by the health district, and have we seen any positive results of contact tracing? The last report I saw was 1,600 people. So that's a lot of people for about a dozen people to be contacting. So kudos to them. But so 1,600, and we have seen cases identified from that contact tracing. We have been able to get people to isolate as a result of that otherwise might not have done it. So that's been good. And why have recoveries stagnated? So we took a bit of a step back from updating our recoveries briefly because we were trying to assess if we wanted to approach that a different way. We didn't end up making any changes to that, so you will see that number shift today as my discussion with the EPI team was going. And when it comes to recoveries, I made a note on the website, and let me make sure you guys understand what that was referencing, is CDC criteria for recoveries. Now, there have been questions about double testing and all of that. We don't test, we don't mandate testing because it's not really within our purview to mandate testing. So we're using a no test recovery criteria. What that means is that an individual, there's some criteria on the CDC website. I'll sum this up a little bit. So an individual who has symptoms of COVID-19 and tests positive for COVID-19 that is not going to get retested has to have gone at least 7 days from their positive test and 72 hours without a fever, and their symptoms have to have been getting better over that period of time. Those people will be considered recovered. However, we do encourage everyone to please contact their physician. If they need doctor's notes, things like that, we're not issuing those. Please talk to your doctor. And individuals who are asymptomatic are asked to wait 7 days after their positive test. They have to ensure that no symptoms did develop and that they are masking. The same is true of the aforementioned group, that they're masking and engaging in social distancing even after the recovery period. And let's see, that is most of that page. What are Bell County's most common symptoms? I went ahead and went through our symptom list and I ranked it 1 through 5. That is muscle aches, chills, headache, GI upset, and sore throat. Number 11, let's see, with asymptomatic cases, how did people learn about their COVID-19 status? Typically, it's gone a couple of ways. They have been tested for one reason or another, and their test came back positive, and they may or may not have had, or they didn't have symptoms, obviously. The other method has been through contact tracing. We did identify some asymptomatic individuals that had direct contact with a COVID-19 case. And let's see, were there any people who tested positive in nursing homes or assisted living? And what cities were those nursing homes impacted in? I'm not identifying cities. We tend to be very careful about drilling down to city level data for reasons I've mentioned before. We've had some positives associated with nursing homes. I know that's been reported in the press in a couple of places. We haven't, fortunately, had any outbreaks, and I'm going to knock on wood now that I've said that. And let's see, did you find any connections between any people who tested positive, such as being in the same family and same church? Yes, absolutely. Family, close contacts have been the most common exposure with regard to close contacts. How many healthcare workers, law enforcement, firefighters? I don't have figures on those exactly. I would encourage that you talk to those agencies and try and assess that. And how many people are in quarantine? Off the top of my head, based on dates of positives, probably somewhere in the range of 50 of our currently tested positive people would be asked to be in isolation at this stage, and any of their close contacts. So 50 to 100, something like that. And what are your thoughts on a second wave? It's way too early to assess whether or not there's going to be a second wave. Ask me later. And let's see here, make sure I'm getting all of these. You guys like me a lot. What is this about? What are you telling businesses that are planning to reopen tomorrow in alignment with Governor Abbott's plan to reopen the state? Follow DSHS and CDC recommendations. And I am not going to be breaking down race and ethnicity by city. That was one of the questions. That's just too small a data point to break down to. And again, our data is not very robust, so I won't be doing that. I don't anticipate we'll be doing that even if we get more numbers. No promises, but I don't anticipate it. And cases in Nolanville, I do not know if we have any cases in Nolanville, but again, any of the smaller jurisdictions are being reported as Bell County because their populations are too small and we don't want to risk incidental identification in those small populations. And I think that's it, unless you guys have questions. Did I talk too fast?
Thank you, Dr. Shadwell. I'd like to call on the Chief Nursing Officer for Seton Medical Center, Harker Heights, Nurse Travis.
Morning. Just give you an update of what we're seeing at the Seton Medical Center, Harker Heights since last week. Our testing has ticked up a little bit because we have started doing a little more surgery. Since the governor came out with his order that we could do that, we're being very conscientious about how we're ramping up and what cases that we're choosing to do. Certainly the emergent and urgent cases would be going first. We do want to get people tested before they have surgery, especially if it's an elective type going forward. One of the things that we are requesting our patients to do is once they're tested, they need to quarantine themselves for a period of time, which we will give that to them when they come in for testing, because we don't want to run a risk of them being exposed during the time period that we have them tested versus them coming into the hospital. Our testing has been stable in the emergency room. Some days we may test only 2 people. The next day we may test 20. Our positive percentage of those tests is tracking right along with the county and as well as the country at between 4.5% and 5.5%. We currently only have 1 positive patient, and that we are the public has done a really good job of practicing good hygiene, hand hygiene, wearing their masks. But one of the things we would really like to reiterate to the public is that once these rules that the governor is backing off of a little bit go into place, is to please remember to continue washing your hands and wearing your mask and taking good care of yourself, staying away from people, the 6 feet rule. It's just real important that we continue to follow those guidelines, because what I'm concerned about is in a week or 10 days, we'll see how that opening up of the of society goes for us. And that's really about all I have for Seton.
See if there's any questions.
Are there any questions?
And from Advent Health Systems in Killeen, Mr. Roberts.
Thank you, Judge Blackburn. It's a privilege to be here again almost afternoon, to meet with our press and talk about what's happening in this crisis that is moving forward. In terms of testing, we have changed our testing protocols. I'll explain that in a minute, but we've had, last week, I believe I reported 26 positive tests since the crisis began through our network of hospitals and clinics. We're up to 31 positives. So there has not been any substantial change in that, which is a good thing. We continue to have our drive-through testing, and that is available for our community for those people with symptoms or known exposure to COVID, people who are positive with COVID. And consistent with the governor's guidance to hospitals, our hospital at Advent Health Central Texas in Killeen will reopen a lot of its elective services starting tomorrow, Friday, May 1st. And we have, based on our reopening plan, we have formulated and implemented across Advent Health, which is 50 hospitals in 10 states, we are COVID ready. And what does that mean to be COVID ready? Well, we've done everything possible to ensure your safety when you come into one of our hospitals or clinics. For starters, we have COVID tested all our doctors and our employees to protect you and them from the virus. And so, for instance, I did my own COVID test this morning. I'm completely COVID free that I know of, but I'll know for sure in a couple of days. And our staff have done that as well. Now, we understand that this is an extraordinary measure, but that's how committed we are to your safety. If you're coming in for an elective surgery or procedure, you will be asked to do a COVID test in advance, and we will take care of that for you at no extra charge. And that way we'll ensure you're in your optimum health for the procedure that you're about to encounter. We're screening everyone that comes into the hospital, doctors, staff, patients, any vendors or visitors who come into the hospital 24 hours a day for fever and symptoms. So since 99% of COVID patients have a fever, you can be assured that those within the hospital have passed that temperature check. And anyone with a fever will be sent out for COVID testing. We have all the personal protective equipment that we need to take great care of you. And all providers and patients will be wearing masks when they're in the hospital for your safety. We've modified our environment to ensure social distancing. New waiting room protocols are in use. You may do a remote check-in or even wait in your car before to come in to maintain that social distancing. There's lots of different ways that we're ensuring your safety. And we're also reopening our main entrance to the hospital tomorrow, and that will be a beautiful thing to see because currently everything has been kind of behind the scenes. So don't put off seeking medical care if you need it. Our doctor's offices will perform telehealth or e-visits if that's most convenient for you. And any patients that are symptomatic for COVID will be kept separated. And that is part of the governor's order, and we are easily complying with that. We have plenty of space. Our emergency department, outpatient and inpatient, provide a quarantined area for anybody with a respiratory illness. So even during the screening process, we're making sure that your safety is our #1 priority. So for any outpatient services, mammograms, MRIs, ultrasound, CT scans, or drive-through COVID testing, for symptoms, you can still call the same number we gave out last week. It's 254-519-8500, 254-519-8500, so that you, and if you need elective surgery or a procedure, then of course you would be getting that scheduled through your physician. But the doors are opened, and we are ready to serve and ready to get back to doing what we do best, and that is caring for our community and helping you to feel whole. So that is the end of my presentation. Is it? All righty, thank you very much.
Thank you, Mr. Roberts. I'd like to call on Dr. Greenberg now from Baylor Scott & White. He's the Director of Emergency Medicine there.
Morning, Bobby Greenberg from Baylor Scott & White Health Emergency Services. Was here last week with the same people, and I think the report I have today is that things are mostly stable. Whether that's good or bad, maybe a whole different story, but it seems like we have hit a level currently that is stable. That may be the top of that flattened curve. We may be at the plateau. As Dr. Chadwell said, we don't know if or when a second spike comes. But right now we see that our numbers are stable. They are not going down, but they seem to be stable for the short period of time. The national projections actually show that I believe yesterday was supposed to be our day with the highest number of cases and the highest amount of resources to be used. At Baylor Scott & White, just like our other facilities in the county, we're doing the same type of screening when you come in. People are masked, employees are masked. We are starting up our elective procedures and surgeries as well tomorrow. We are doing screening for all of the patients to have procedures, and we're going to maintain a safe environment for our patients, our visitors, and our staff. One of our core values at Baylor Scott & White is that we're in it together, and as I hear our colleagues from the county, I realize we're all in it together, and I think that's the strength of what we have here. The only thing I was going to talk a little bit about is something that Dr. Chadwell talked about as well, and something that's been touched on a little bit, and that is some of the change in the testing. Previously, and I think we talked about it last week, when we said testing, that was only the antigen testing, actually testing for the virus. In the last week, fairly quickly, there has become more emphasis because there's more availability of antibody testing, which is where you check the body's response to the virus. The short story on that is none of us are quite sure what to do with this yet, especially for individual patients. It's very early in the game. We don't have enough data to figure out what it means if your blood test is positive, besides the fact that you are exposed at some point to the virus. We don't know that it means you're immune. Nobody, I would say none of the national organizations are recommending that you use that test to make a decision about, one, how to treat a patient, or for an employer to decide to put somebody back into the workforce just based upon that test. And I believe actually that's all I have for today. I'll ask if there's any questions.
Thank you, Dr. Greenberg, and thank you, Mr. Roberts. Thank you, Nurse Travis, for your comments. And if you would just hang around just a little bit in case there are questions at the end, and we'll try to address those as we go forward. I've got just a few comments that I want to make today, and then I'll open it up to just general questions that we haven't addressed or that you'd like to readdress. We are going to have to close this press conference. I should have said this at the beginning also, but we are going to have to cut it off at the noon hour if we're not done before then today. A couple of things that I want to highlight. As all of you are aware, on April 27th, the governor issued GA 18, which is the Reopen Texas order, or what's been referred to as the Reopen Texas order. I won't go through all of those things. They're posted online. He also issued a handbook associated with that. And then associated with the handbook, there's also some information posted at the SHS website, a document called Minimum Standard Health Protocols for COVID-19. And in that document, which is in large part reproduced in the governor's handbook, There are health protocols for about 17 different sectors in the economy and in the business community throughout Texas. One of the things that I have been asked frequently over the past few days since the governor's order has been issued is what guidance is there for businesses and what should they be doing in terms of preparing for reopening tomorrow. And my answer to that has been just what I've mentioned. I would urge them to carefully review the governor's order, carefully review the handbook, and carefully review those DSHS guidelines, health protocol guidelines. There are multiple sets of guidelines depending upon the business. If you're a restaurant, if you're a retailer, if you're a church, if you're whatever the industry is, and not all industries are addressed in the handbook or in the DSHS protocols, but many are, and I would urge businesses, have urged businesses to continue to look at those and study those. That said, I also have urged them to work toward meeting those health protocols that have been recommended by the governor's office, and to the extent they can, exceed those protocols. The health protocols have been established by the governor's office, by state health officials, and local area officials to help protect the public health, welfare, and safety. And to the extent that you can meet and exceed those health protocol standards, in my opinion, you're also going to be recapturing your customers and encouraging new customers to attend your business because they're going to feel safe or safer in your business. So I would urge you to do that. Again, look at them with a very critical eye, but with an eye to what you can do and what you can do more. Another question that I have gotten quite a bit over the past few days relative to one specific area in the governor's orders has been under the retail to go, in-store retail services, and in particular, the occupancy limits that the governor's order has set, which is 25% of occupancy in terms of opening up. That's for dine-in restaurants also with less than 51% of their sales from gross sales from the sale of alcohol. But in retail sales, dine-in restaurants, and the occupancy limits. And the question I've been getting from businesses have been along the lines of what are those occupancy limits, and who, when, and how are those occupancy limits going to be enforced? And my response has been, from the county perspective, every business has got issued an occupancy, certificate of occupancy, and a certificate that indicates what the occupancy load is for their particular business or establishment. I would encourage them to use that number when calculating the 25%, and then self-police that. In other words, the business is responsible for maintaining that 25% occupancy load limit. I think 99.9% of the businesses will do fine with that in terms of monitoring that on their own. I think they're going to be very conscientious about that, just as they have been with compliance of previous orders. In terms of how enforcement will occur, from the county perspective, it will operate the same way that our COVID-19 compliance initiatives have operated to date, which is typically by complaint. So when we get a call or an email or a visit from someone that says there's an issue with this particular restaurant business, then we'll respond to that and check it out. But I think that will continue in the same manner. And again, that's one of the most frequent questions I've gotten over the past few days. The second thing I would say in regard to guidance for businesses and what they should be doing, and if they've got questions about what they should be doing or how they should be doing something, I'd reiterate the email address that the governor has indicated is available and you should utilize as a business owner or an individual if you have a question or a suggestion or want clarification for an order. And that's local.input@gov.texas.gov. Again, the governor's advised that questions be directed to that email. So I would encourage you to do that. A couple of other areas that I'd like to comment on briefly is testing sites. And I think previous speakers have addressed that also. But as I said last week, I believe we have 5 or 6 testing sites open across the county. We're also going to be opening up on May 8th through the Texas National Guard 2 COVID testing sites in Bell County. Those sites are at the Troy Volunteer Fire Department Station, 201 East Main in Troy, and the second one is at Rogers Volunteer Fire Department, 6 West Mesquite Avenue, or 6W Mesquite Avenue, Rogers. Those test sites will have some testing capabilities. They will be by appointment only, so it's not a drive-up test site. You must make an appointment. It's my understanding that you still need to, you'll be some health screening before you're cleared to go get tested at those sites. And more information about how you can make appointments will be made available next week in terms of that. So watch websites and your respective news medias as we push that that information out about where you can call or the number to call for making an appointment if you want to go to one of those sites. Update on complaints we've received or COVID-19 compliance efforts. As of today, we've received a total of 213 complaints or requests for investigations. That's 12 more than I reported to you last week. And then the last, next to the last thing I was going to mention is I received an inquiry also from one of our media outlets just a little while ago about the Bell County Communications Center and information that news outlet had. And I want to go ahead and advise you that we have had 2 county employees test COVID positive at the Bell County Communications Center. The Bell County Communications Center is our regional 911 dispatch center. It's a very critical piece of infrastructure for the county and for all the residents that we serve. We are in the process right now of testing all 100 or so of those employees. We have, since the beginning of this COVID event, had heightened screening requirements and hygiene and sanitation practices in place at the comm center, and we'll continue to do that. And we're also taking some additional steps to ensure that there's no interruption of services of 911 services across the county as a result of that. All right, with that, I will stop and be happy to answer questions or direct questions if you've got some additional questions.
I had a question on the 25% occupancy. Just to reiterate,
Yes.
That would not include anybody's staff. That is just for like a dining room area at a restaurant or something. Is that correct?
That is correct.
Okay.
Hi, this is Jasmine with Channel 6 News. Can you speak as to why neighboring counties, like such as McLennan, have seen like a decline in numbers, and in Bell, it's a bit higher, like at 174?
Yeah, I'm going to direct that to my public health director, and then if there's a healthcare provider that wants to comment, I'll let them do that also. But first, Dr. Chadwell.
There could be a lot of reasons for that. Now, I haven't done any assessment of our neighboring counties. I've been focusing on ours for obvious reasons. But we do have a population that has a median age of about 30, so it may be that we're more mobile. It may be that we have more people working in essential services. I mean, there could be a laundry list of reasons. I haven't looked at the testing numbers in those counties, but we may be doing more testing. That could have something to do with it. Really, it could be a whole lot of things, but if anyone has anything to add, welcome to add to that.
Next question.
Can everybody talk about why it's still so important to wear a mask even as these businesses reopen? Just kind of reiterate that for the public.
I'll ask Dr. Chadwell to come back. I'll offer a comment on that here in just a moment, too.
As you see, the mask. So again, the masking is not necessarily about protecting yourself from getting the infection. It's the notion of asymptomatic carriers. There are some people who may have the illness and not yet be symptomatic, or may not develop severe enough symptoms to realize that they're ill, and they may be contagious. So if people who are well wear a mask, they're offering some protection to themselves. If people who are sick may not know that they're sick are wearing a mask, they offer protection to others from themselves. If everyone wears one, that is double protection for everyone. So we're encouraging, no matter what, wear a mask.
This is Bobby Greenberg again. The only thing I would say about masking is please keep in mind it is not a substitute for appropriate physical distancing or hand hygiene or watching out for other areas where you can be infected. Sometimes the mask gives people a false sense of security. It is not a replacement for the other methods to protect yourself and others.
I was just also going to offer on that, and again, I'm just going to read this from the minimum standard health protocols for COVID-19 that was issued by Texas Health and Human Services, which I refer to as DSHS, with regard to the wearing of face coverings. And the first comment I would make is that it's not mandatory. There's no state order that requires that, and there no local order that requires that. But here's just, as I mentioned a moment ago, there are like 17 different categories, checklist that the state health department has issued for health protocols. And this is just, I'm going to read the one from directed to all employers in the state of Texas. Have employees maintain at least 6 feet separation from individuals. If such distancing is not feasible, then other measures such as face covering, hand hygiene, cough etiquette, cleanliness, and sanitation should be rigorously practiced. When you, consistent with actions taken by employers across the state, consider having employees wear cloth face coverings over nose and mouth. If available, employees should consider wearing non-grade medical face masks. Again, those are the recommendations that have been pushed forward from the state. And my read and the counsel that I've been giving businesses that have been asking those questions is, I certainly would encourage you to do that. There's no requirement that that be done. And to echo what Dr. Greenberg mentioned just a moment ago, the face coverings are not a substitute, and I think the state health protocols underscore that for all of those other measures that the businesses and individuals should be taking.
Could you speak to why it's not mandatory? If this is something that's highly encouraged, and Dr. Chadwell says if everybody did it, then everybody would be double protected. Can you talk about why there's been no talk, even at the local level, to make that mandatory?
Well, I can certainly address it at the local level, and that's because I believe the governor's orders have preempted and superseded the ability to implement that, even if it were desired to be done so. So at the local level, I don't think there's the ability to mandate that. But what I would say, and again, I may ask Dr. Chadwell to come back and correct something that I might state in terms of her comments. But I think the benefits employed by wearing the cloth face coverings that are not the N95 respirators and have all the filters and all those kinds of things in them are not necessarily as effective as the other measures that, again, the state health protocols, CDC and everybody else has pushed out in terms of frequent hand washing and social distancing, just maintaining those social distancing wherever you can. But I think, again, there's also a perception, this is just from my standpoint, I think there is a perception by many that if you're wearing a face covering, then you're 100% protected. And I think that's false. And all the healthcare professionals are shaking their head vigorously, which again, but that perception is out there that it gives some false sense of security and as a substitute for those other measures that, again, our state and federal and local health officials are saying we should do. And I'll let them come up here and correct all of that.
So from the public health standpoint, again, it's highly recommended because it is an additional layer of protection. But as Dr. Greenberg pointed out, it's not a substitute. You don't mask, as much as I said this about gloves in the past. Don't assume that you're protected just because you're wearing gloves. Don't assume that you can't cross-contaminate. Don't assume that social distancing is no longer necessary. And don't assume that, oh, because I wore a mask today, there's no chance that I might have been exposed or that I might have exposed someone else, et cetera, so forth. So adding that as an additional layer of protection is, yes, highly recommended, but it's not feasible for everyone. There are some people, I think in the original documentation, and it still says that in documentation now, children under 2 shouldn't wear a mask. It's not safe for them. There are some people with medical conditions who cannot feasibly wear one because it's not safe for them. So there are circumstances like that. And then there's just the accessibility of materials for masking. Some people just can't get one. And it doesn't really make sense to be mandating this and then saying, hey, we're going to write everybody a citation who doesn't wear a mask. It's kind of a waste of resources. But if you can do it, please do it.
Any other questions?
With businesses getting ready to open tomorrow, are there any plans or anything with or any kind of help they can seek from the county with relief funds?
Good question in terms of relief funds. Again, I think we talked about that a little bit last week also. The area chambers of commerce is the primary resource bank that I have been forwarding folks to or recommending that they check out. Killeen, Temple, Harker Heights, Belton, all have been very proactive in publishing information that is available to help businesses, and in particular small businesses. And so if you go to their websites, you'll find links to a lot of different venues for information from the Small Business Administration to federal agency, other federal agencies. So that would be what I would encourage folks to do. The chambers have also been very responsive, I think, on a one-to-one basis. I've heard many businesses indicate that they went to those, maybe a federal or a state website, had some questions and some concerns. And again, our local chambers have stepped up and I think have been assisting small businesses on a one-to-one basis as they can. Next question. Last call. All right. Thank you for your time today.